Hi, Kevin Henry, the Group Editorial Director for Advanstar and Dental Products Report. I'm here this morning with my good friend Heidi Arndt on a Google Hangout. Hey, Heidi, how are you?
Good. How are you, Kevin?
All good, all
Good.
good. I appreciate your time. Heidi's been a good friend of mine for a number of years, and Heidi, I want you to tell our viewers a little bit about what you do.
Yeah, thanks, Kevin. My name is Heidi Arndt, and I am the owner of Enhanced Hygiene. And what we do is we work with dental group practices to help improve the profits that stream from the dental hygiene team. So we work with the development of the dental hygiene team. We work with the management of the dental group to help understand their opportunities from hygiene.
And I know you're a hygienist as well,
I
so
am,
tell
yes.
me, tell me a little bit about some of the ways that you're seeing practices improve their bottom line through the hygiene department.
Yeah, great question. One of the biggest things that I see initially is when clients call me, they're trying to understand, first of all, what their opportunity is, if there is an opportunity. And I think in the past we've heard that hygiene is, a loss leader, and I thought that whole adage was gone. People didn't believe that anymore, but I still do believe that thought is out in the industry. So helping them uncover what their opportunities are in regards to potential for profit increases in hygiene. And when it comes to dental group practices, it's a matter of creating, systems and standards and consistency that make the biggest difference in the dental groups.
And, you talk about group practices, and it's really that unknown right now. So many people are saying group practices are starting to take over the industry, and people are wondering, is it a good thing? Is it a bad thing? What are some of your thoughts on group practices and the trends that you're seeing out there?
Yeah. I do believe that dental group practice is growing. Do I think it's going to take over the country? No. There's room for the solo practitioner as well. I've worked in dental group practice for years, and I like the dental group setting for a couple of reasons. One of which is the ability to mentor and learn from all the other people within the organization. There's oftentimes a lot of support for the dental hygienists and the doctors for continuing education and development and learning far beyond what we've learned in school. I also like the standards that come in place with a lot of dental groups to create that consistency. Where I came from at American Dental Partners, we had consistent standards and a strong quality assurance program in our practices, which I think really improved the level of care we provided.
So Heidi, if I was going to ask you for one tip maybe that really might help the hygiene departments out there and the dental practices that are watching this, what would you throw out to them?
Number one, I would say, and this is probably you've heard this from everybody, but you need to have a strong standard of care or a protocol in your practice that everybody can relate to and everybody can believe in. And if you're looking for one area to improve the care for dental hygiene, I still believe it's in the periodontal care arena. When I walk into practices across the country, that's the one area that I still see as a weak link in the practice. So I would encourage the practices to really improve their education in periodontal therapy and the oral systemic link, and that can make a huge difference in the patients and the practice.
Heidi, hey, appreciate your time. Why don't you tell our viewers where they can get more information about you if they want to get a hold of you?
You can reach me at my website, which is www.enhancedhygiene.com, or you can email me directly at heidi@enhancedhygiene.com.
Heidi, as always, I appreciate the time, and it's great seeing you.
Thanks. Nice seeing you too. Thanks for the opportunity.